surgeon, Boca Raton. Named one of South Florida's top dogs by South Florida Magazine. Voted best cosmetic surgeon. Dr. Man has appeared on Good Morning America, the ABC Evening News, American Joe Pittsburgh, CNN, and in the Florida Magazine. And he's here now to answer all your questions about cosmetic surgery for men and women. So get on the phone, 877-850-8585. That's 877-850-8585. Now, here are Karen Curtis and Dr. Daniel Mann.
Welcome on this Memorial Day weekend. Thanks for joining us. Dr. Mann and I have known each other for about 2.5 decades, and it's so good to do the show with you because I love to allow you to tell everyone about the procedures you've invented and the products you've invented and the innovative things that you can do through plastic surgery. You're board-certified plastic surgeon, board-certified reconstructive surgeon, and the sky's the limit with you when you find a patient that needs help, right?
The most important thing is to make people feel good, to make them look natural. Not different, but better. And that's what we have been working all these years.
And I want to send you to his website as well. It is drman.com, and there's before and after photos and everything on there. You have several products that you've covered. The cream is amazing, the DMMD cream that you've invented. It took you years to do it, right?
Especially, yes. Especially for patients who have a lot of sun damage, large pores.
Down here, yes.
The melasma, which is the brown pigmentation, redness of the skin, even acne, and scars of various kinds.
Really, and it'll fix that?
That helps it.
It helps it a lot.
Yes.
So how does that work? You put it on once every 2 weeks? Or?
Well, first, what it is. It's a broad-spectrum time-release cream that helps to rejuvenate the skin and penetrate the skin and get better results as time passes. And you clean the face in our office and apply the cream, and the cream dries in about half hour, so there's no problem. You sit in the car, drive, nobody knows you have a cream on.
Okay.
And you wash it off after 8 hours. Then you do the same thing in 2 weeks, you wash it off after 6 hours.
Wow.
And at home, you apply pea-size cream, just pea-size, once a day for 6 months, preferably in the morning. And the first 2 weeks, you do it twice a day, and the skin gets better and better.
Wow, that's amazing. And I know with your facelifts that you do for men and women, you've invented techniques that hide the scars. And men have different skin and different facial construction, so you have actually come up with a different procedure for them, right?
Very important for men and women to look natural and not to show the incisions, the scars of the facelift. Hide them within the ear. So it's not incisions like in front of the ear or behind, horizontal behind the ear there, within the ear, and there's a special technique that is being associated with this, and the results are looking great, and they last for a long time.
So, you know, some of these men that have had procedures like Mickey Rourke, he looks terrible. I mean, can you fix that when someone's had a facelift that's got the incisions?
Yes, I have come across some patients who had a previously done facelift, and the scars were noticeable, and they look pulled. Those ears that go down, they call the pixie ears. They don't like that. And when they have this unnatural look, I do have a way to help them to make them look better.
And so what do you do for women who have had, you know, too many and they're too tightly pulled and it looks like they've been done? Can you fix that?
Yeah, the first thing is to try to correct some of the previously done work. If the ears are pulled down too much, there's a way, the suture suspension that I developed that works quite well without leaving scars, that puts the ear back in better position. And then you could use various kinds. One is like fat, to build up areas where the fat has been lost. The other one is to use fillers, and now there are fillers that last anywhere from a year to 5 years. Remember,
really?
There were fillers that
Yes.
lasted only like 3 weeks.
I know, why bother?
Yeah, they last a long time now. So that works good. And on top of this, you can improve the skin with a cream that you mentioned, the DMMD. And then if they want to have even longer lasting results, we can go into creams that will give them even 20 years results, like the skin rejuvenation peel. So these are all, it depends how young the patient want to look. Better, we have to take it for granted. They have to look better. Now, do they want to look 1 year young, 2 years young, 5 years young, 10 or 15 or even 20 years young?
Wow.
And that we offer to patients according to their wishes.
We're speaking with Dr. Daniel Mann. He's a board-certified plastic surgeon from Boca Raton. If you'd like to call, 877-850-8585, 877-850-8585. And I had, as a health reporter at Channel 25, I did follow you, and we did a story with you on a woman that had a peel. She had that crepey kind of wrinkly skin, loose skin, and you did the peel. And the before and after, we waited for the after until we aired the piece. And she looked, I would say 20 to 30 years younger. That crepey skin was gone. It was just like a baby's butt, the skin that was left behind.
They come with real deep lines. Sometimes the lines over the upper lip look like a barcode.
From smoking, right?
Yeah, not necessarily, just from time and sun exposure. These lines would get deeper, and when the lines are starting to change directions in the face, let's say some of them are horizontal, some oblique, some are vertical, that's a sign that they lost a lot of skin elasticity. In these patients, you don't want to do a facelift. You want to do a procedure that would help their wrinkles and make them look better. And the skin rejuvenation peel, please go to www.drman.com and look on procedure SRP, skin rejuvenation peel, and see how many of these that have very deep wrinkles are now almost wrinkle-free, and they will last for about 20 years.
And it tightens the skin, so you don't need the facelift. It's a non-surgical. You won the award for non-surgical rejuvenation.
In many cases, the results are so good that they don't need to do the additional operation. Especially if their neck looks fairly good, they don't need to do it. But if they want to, later on, they can still opt to do like a neck lift, but then the procedure would be shorter than before.
How do you do a neck lift? How does that work?
Well, you could do a neck lift with the incision underneath the chin and behind the ears, and almost no removal of excess of skin. Just putting the muscles that cause this sagging of the neck back to where they were when the patient was younger, and then the skin just falls back into the right place.
So it's the muscles that have loosened.
The muscle is the problem, yes, and they sometimes separate, and there's some fat between those muscles, so we remove that fat.
The chicken neck.
Yes, exactly.
Yeah, because that really tells your age. Your neck can really give you away, and it's a dramatic change when that goes away.
Looks beautiful.
Right, it really does. It's amazing what you can do. Tell me about Sculpture, because it's you can remove 24% of fat without any surgery, any suction, any incisions, nothing, right?
Sculpture is a very unique way of doing it. It's the first FDA-approved machine, laser, that treats, regardless of color of skin, anybody for excess of fat. And in 25 minutes, 24% of the fat disappears within the next few weeks.
Wow. The
patients are very happy. Why are they happy? Because it's real. It's you can say, well, painless liposuction or smart painless liposuction without a need for surgery, without having anesthesia. They sit in a chair, just like we sit now here, and they have this pads put on their skin, and the coolness goes through the pads, followed with a laser, and the laser actually makes those fat cells disappear, and the body takes it apart and gets rid of it. So the next 6 to 12 weeks, they look better and better, 24%.
It just goes out through urination. Right?
Yes. Mm-hmm.
Because when we lose weight, the fat cells are still there, right?
Right.
They don't go away. And
That's
this
right.
makes the fat cells go away?
Destroys the fat cells in such a way that the patient doesn't even feel that happens, and the skin retracts a little bit, and the patients feel better, especially if they're doing these exercises on a regular basis.
These are problem areas they can't get rid of.
Right, they can't, and this time they can.
Like love handles and after babies, that like little bulge, the muffin top type thing.
Sculpture works very well on belly fat, love handles, other areas of the body. Wonderful.
What about men that have the female type breast, the gynecomastia? You've invented a procedure. We did a story with you on it. You actually suspend the sutures and all. They can take their shirt off at the beach now.
Right. The problem is really epidemic of men who can't go to the beach or to the swimming pool because they find themselves being embarrassed.
It's embarrassing.
It's almost like a taboo for them. They have to hide them. And we have a way to do this procedure that it doesn't leave them with large scars, just small ones. And I do on them special liposuction and laser, and then suture suspension, so the excess of skin learns to go away with the suture suspension. Those sutures are removed in about a week, and the patients are much better.
I remember I did a story on gynecomastia back in like 1988,
Yes.
and the guys in the newsroom were making fun of me. Said, "Who has this?" I'm like, "Well, this photographer has it," and I mean I could point out in the room who had it. You know, I say it's very common.
50% of men are affected to a certain degree with this deformity, and they look for a solution, but there's a way to do it.
And they try to work out and
Right,
make
and
the
it
pec,
doesn't
and
know.
that fat stays there.
Yeah, sometimes history of use of steroids in the past, all kinds of supplements that can cause problems. Now we have a solution for this.
It's amazing, and you invented it.
I did.
Let's go to Nancy from Boynton Beach. Dr. Mann helped you out. What did he do for you, Nancy? Hi, Nancy, you're on the air. Is she up? Nancy, hi, you're on the air. Oh, we lost Nancy. She'll call back. 877-850-8585. 877-850-8585. Yeah, I mean, some of these men have a C cup. I mean, and it's just, it's embarrassing when you're in an amorous type of setting. I mean, you know, it's hard.
Right, but there are two types of it. Some of them have a large amount of fat in the breast, and others will have more breast tissue. So you need to find out during the procedure which one you're dealing with more. So if fat, usually suction helps a lot, then the suture suspension helps as well. But if they have breast tissue, you also remove the gland itself and send it to pathology. Now they're not going to have the gland, and they're going to be much happier, because then the fat and the gland both are taken care of.
And they won't come back.
No, they usually don't come back. I remember doing for the past many years, and very few of them need additional attention.
All right, beautiful. And facelifts for men and women, a different procedure for each one?
Definitely.
Interesting.
Yes, why it is important? Because men need to continue looking like men, and women need to be more feminine. And if you look at the difference, in women, the cheeks are more round. In men, the temples should be fuller, as well as the cheek and the jaw lines. So the difference between them. But what is common is that both of them, men and women, they want to look natural. And that's where the incision inside the ear is helping.
So you do that with both?
Both.
Okay.
Yes.
Let's go back to Nancy. She's called back. Hi, Nancy. You're on the air with Dr. Mann. How are you? Yay.
All right, let me get your first name. Hold on one second. You're going to go on air, Dan. That's great. Okay, I'll have to ask after the show. I'll go ahead and ask after the show. I can't bring it up right now live on here.
Wow. So what do you mean you had too much plastic surgery? Did you become addicted to it and you had too much, or what did you have done?
Okay, what's your number? So what's your name? Chip. 704-9179, right?
Wow, Nancy, this is really important because a lot of people have this problem.
Right, and I'm not the only one. They're very good, many board certified plastic surgeon. But what I like to do is, being also as an artist, sculptor and a painter, I do have a way to communicate with patients and show them actually what can be done, what should be done to make them look more natural. And in many ways, it does work, and it worked beautiful for Nancy.
Wonderful, Nancy. Thank you so much for calling.
Thank you.
What do you do to help someone who's had too much blood? I mean, you can't put skin back that's been removed.
Right,
So.
but you can change the relationships so there's more harmony now in their face or body. Depends what kind of problem that they are faced with, and then you continuously work at this. So you know, a house is a house, but when the house gets older, you can still make it look pretty, right? By putting the right work into it.
Exactly, right. And you know, by fillers, you were saying some of these fillers last, they were 3 weeks, and you go back and for your lips. And now, what is this made out of, this filler that lasts for 6 months?
Well, first of all, when patients come for fillers, they see either me or Wendy, our physician assistant. What they're asking for is to rejuvenate their look, maybe look a year younger or 2 years younger. And we have fillers that last all the way up to 5 years. So these fillers are wonderful because you can put them in the places where we have lost the volume. And as volume has been lost, we develop some sinking, and sinking leads to sagging. So by putting the fillers in the right place, they no longer have this problem of sinking, and they feel better about this.
Yeah, sinking and sagging. I mean, I had a lip. You put a lip implant with me,
Right.
but I probably need some more fillers with the lip because I want them. I don't want them to be all puffy like the Kardashians, but I want a little more.
A little bit always works nice because.
And now that you're telling me it lasts this long, because I'm so busy, I don't have time to keep coming back, and you know.
And not only that they last long, but some of those fillers are reversible. If you don't like them, you can do an injection and it'll take it back to where before the filler was.
And that is very comforting.
That's very, very good.
Right?
Yes.
You know, because it's like you think, oh my, I'm permanently doing something, or for 5 years I have to deal with this. So
Much
if it's too
safer.
big, you're like, wow.
Yeah, much safer today than years ago.
Well, that's why I like the lip implant, because you said you could take it out if you wanted to. But no, I love it. It's so natural looking, you know. It's like, and you did yours. You had
Yes.
yours, and I was like, I love
Right.
your lips. I want those.
That's
so.
right.
We're talking with Dr. Daniel Mann. He is a board-certified plastic surgeon and reconstructive surgeon from Boca Raton, and beautiful practice. You have the surgical suite right in your office, and it is all FDA approved, and it's just a very safe environment. You have an apartment down below where you can, after the procedure, spend the night, right?
Right. Patients are allowed to stay and they have a care. We really take good care of these patients from the get-go, from beginning until everything is finished, and that's why you hear that they come back.
Yeah, they love you, and it's very luxurious.
We love it.
What about the argument that it's better to have the procedure done in a hospital? It's not, if you have the crash cart and everything is safe and.
Well, first of all, it's better to go to a board-certified plastic surgeon.
Please.
And when you go to a board-certified plastic surgeon, it's important because that's what he does. You're not going to go to a dentist to have your heart taken care of. Why should you go to non-board certified plastic surgeons do plastic surgery type procedures? Second is depends on where he or she does the procedures, and if they have a fully accredited facility and that's where they do most procedures, that's probably better for patients. It's cleaner, probably less expensive. It's controlled by the quadruple PSF, and there's a way to check. First of all, when you go to a plastic surgeon, look for board certification, see the facility, talk to patients who had previous procedures done, similar to what you're looking for.
Well, and you're on staff at several hospitals.
Boca Regional Hospital.
Right. So I mean, you also look for that. You make sure
Definitely.
that they're on staff somewhere at a hospital.
Yes.
That's very important.
Which is just across from our street.
Which always scares me going into the hospital. We just had this story this week about the superbug that, you know, they're in the hospital. I'd rather go and be in your office where I know it's going to be clean and I'm not going to catch a superbug.
That is correct.
You know, when you're
Safer.
going, yeah, it is.
Yes.
Absolutely. Let's go to Barbara from Parkland. You have the cool sculpting. Hi, Barbara.
Hi there. Thank you for taking my call.
Thank you.
My question is, I'm interested in
Oh,
something done,
wonderful.
but I think I think that you didn't take the quality and the time that you not have it done. I'd like to go ahead and start
Well, if the first of all, thank you for calling and asking about sculpture. Sculpture is non-invasive procedure. So we never had situations where patients would have ill effect from this procedure because there's no pain involved with this. And the patients are very comfortable with this. So I know of very little issues with this machine, especially if they come for removal of fat in areas like the belly or the love handles or other parts of the body. It's purely 25 minutes with no pain, just cooling and warming, and the patients are leaving the place and they say, wow, I didn't believe that this is over. So I don't think that this were going to be an issue, but again, we have to check every patient and make sure that the patient are correct for this, and we examine, take photos, and show you other patients that have done similar, like sculpture.
What did you say you have, Barbara, that was counterintuitive to what you wanted to have done?
I had what's quality is more in the reflexes and dystrophy, and I was told that research shows that you don't have the procedure that was wanted, and consulted two doctors about it, and that's why they suggested to take it down and change. I have had it, that's why it's gone over.
I think you can do it. You can try an area that is fairly easy to treat, and you see that there's no problem. I've never heard that the reflex sympathetic dystrophy would be a problem with this kind of non-invasive procedure. So we're talking here about the non-invasive procedure where the patient's comfortable sitting, cooling. When you put an ice on your skin, probably you don't have a problem. When you put some warm towel on your skin, probably you don't have a problem. So it'll be similar to it.
Okay,
Yes.
I appreciate the information.
Sure.
All right, Barbara, go see Dr. Mann. He's in Boca, and the number is 888-822-7543. You can talk to Mick, and he'll make you an appointment. Thank you so much for calling.
I appreciate it, thank you.
Thank you. All right, and Daniel, implantation, we were just talking about the condition that you had, and Dr. Mann helped you. Welcome to the show. So tell us about, you had gynecomastia? Wonderful. And how big were you? I mean, how big of a problem was it? Oh, wow.
You see, the quality of life is given back to them. The patients can go now to the swimming pool and do whatever they want, exercises, and wear normal clothing. Right, Daniel?
Go without a shirt, right, Dan?
Oh yeah, no, I mean now, after I got cleared to go back to the day I got cleared, I went and started swimming, in my pool, not, worried about, having these big, breaths and everything.
And this started when you were
Very happy.
12, so that's like a really tough age to have something like this going on.
Yeah, I was 12 and I know when I used to in sports and all that, it was really embarrassing, especially in the sports that I did. So, I'm just happy I have my,
And how did you find Dr. Mann and know that he had invented this procedure to help you?
actually my mother found it.
Yes. All right, Daniel, thank you so much for calling.
Thank you. See, that what's so special about it, that young people are now going for this. In the past, they used to suffer and suffer
Wait.
years,
Oh.
and they used to come in their 40s.
Oh.
Now, when they come early on, you give them a whole many years of good life where they can do like all the rest of us.
Just know that you're not alone. It's nothing to be embarrassed about, and there is a solution.
Right.
And it's easy. I mean, the procedure, the downtime is not that much, and the outcome is amazing. It's like night and day.
Right.
And
And we have now even medication that you put underneath the skin that takes away the pain for the next few days. So they are even a lot more comfortable than even in the past.
because, yeah, sometimes after the surgery it can be a little bit uncomfortable. That's
Yeah.
amazing. So you can do that even with facelifts, right?
Yeah, we use the medication, takes away pain, and the patients can take care of themselves and come back to normal life much easier and faster.
So, and downtime is part of any kind of plastic surgery procedure. You just have to know that it's not going to be an immediate fix.
Depends. We have the non-invasive, non-surgical procedures that there's virtually no downtime with this, like the DMD, the fillers, the various kinds of microdermabrasion, microneedling. There's no really downtime with this. Or use of platelet-rich plasma, there's no downtime with this. But then some of the surgical procedure will have some downtime, and the patients need to prepare for this. So maybe it will take a week, 2 weeks. If everything goes fine, shouldn't be a problem.
And sometimes it gets better and better 6 months out. You're still getting better.
Definitely. In the case of SRP, skin rejuvenation peel, the patient look at 6 months better than in a month, in 2 years better than in 6 months.
Really, 2 years?
Yes, and towards 5 years, that's when they peak, and they continue having this nice appearance that lasts up to 20 years.
Yeah, I remember that story we did with that woman. She still looks fantastic. It's amazing. Now, in terms of affordability, I know that there's care credit and there's all kinds of ways that you can work this out so that anyone can come in and afford a procedure.
Right. When they come to the office and they meet with me or Wendy, Eliza, or Magenta, and Hazel is greeting them, Mick is greeting them, it'll become clear after they see the facility what are the options to go through so it's not difficult.
Right, and it's so enjoyable to meet. All of your staff are wonderful, and you have your paintings in the office that are beautiful, so we see that you're an artist. And you actually have a painting that was at the White House, right?
That's right. Years ago it was at the White House.
You donated it to the Clinton.
Right.
The Clinton, well, we want Trump now, right?
Right.
Go Trump. Well, it's Dr. Daniel Mann. If